and Tina's going to be here for 45 minutes talking, and there'll be plenty of time for question and answers. Thank you. Tina.
Thanks, Hannah. Thanks for inviting me. So as Hannah said, I work for ActivInsights. By trade, I'm an exercise and nutrition scientist, but I've worked at ActivInsights for about the last 6 years. Okay, so we know from the talks earlier today, we live in an ageing population, and there's 4 diseases which cost more money and destroy more lives than all other conditions globally. Not sure why it's coming up funny on the screen, looks all right on mine. Heart disease, lung disease, obesity, diabetes. And lifestyle is the most important common factor in the prevention and treatment and management of these conditions. Many people have multiple comorbidities, so they're living with more than one chronic disease, which constantly increases the burden on the health services. So we're constantly bombarded in the news headlines of all the problems worldwide. In 2015, more than a quarter of deaths were attributable to stroke and heart disease. Diabetes killed about 3% of the population. In the top 7 causes of global death, 6 of those were non-communicable, so preventable with health strategies. Millennials, so those born in the 80s and 90s, by the time they reach middle age, 70% of them are going to be overweight or obese. Got it right this time. And diabetes incidence is constantly increasing. Diabetes diagnoses have more than doubled in the last 20 years, and they're creating such a huge burden on the health service, which is already struggling. Successful population health management starts with knowing which patients are going to benefit from targeted interventions. Now, the consumer and research markets for wearables are well established, but a market that's rapidly increasing is the space in the middle for professional wearables, which is the healthcare market. Approximately 50% of all GP appointments and 70% of health and social care budgets are all for long-term conditions where lifestyle is critical. So we really need to invest in preventable healthcare strategies. So I'm going to talk to you about Accelerometry, because ActivInsights, as a company, we sell wrist-worn wearables which are all based on accelerometry. It's a simple technology. It's been around for a long time and used to measure human movement since the 1980s. But it's becoming increasingly sophisticated and informative. It's all about the data accuracy and the data analytics. There's a responsibility to provide unbiased and accurate data-driven insight into lifestyle data activity. What people don't need is a data dump. So in terms of professional service, we've got to be able to provide some insight to inform the patient needs and not just overwhelm them with masses of data, which perhaps the consumer devices do. Really, we need to provide the skills of an IT guru and a data analyst to give them a fast and simple interpretation of their data to inform patient care. We don't want a device that needs to be constantly babysat, so it's got to be easy to use. You don't want to have to spend a lot of time charging it and maintaining the device. It needs to be more than just an activity device. It needs to be a precise activity device to be able to inform health outcomes. Preventative healthcare is all about understanding the patterns of activity and sleep and work and leisure to be able to make these changes for the better. And a 10% increase in physical activity across the UK would save 30 billion a year for the NHS. That's a huge sum of money. And preventative healthcare is particularly difficult to sell, as our speakers alluded to this morning, because often these systems are run by accountants rather than the people on the health at the face-to-face service. And the accountants require a quick return on investment, and it's very difficult for them to view the long-term picture and to put a price on the preventative side. So what can wearables do and can't do? Well, with accelerometers, it's easy to monitor activity for several days with low burden to the subject and provide real-time information on intensity, duration, and infer frequency. So they can't tell you what a subject is doing, what specific behaviours, but together with diaries and other aspects, they can provide a powerful picture of lifestyle activities and behaviours. And they can predict health measures directly related to acceleration, for example, in bone health. What they can't do is they can't give a direct measure of energy expenditure. And the devices that state to be able to do that, you know, they're all giving an approximation of energy expenditure to greater or lesser degrees. Some are much better than others. At the moment, also, these devices cannot measure exertion, so they can't distinguish if somebody's carrying a load of shopping when they're walking as opposed to just going for a walk, although that is certainly on the way with frequency analytics when you can look at the movement of the arm and together with footfall. And they can't provide causality on their own. So, consumer wearables, which I'm sure many of you are probably wearing now, provide personalised feedback. They give you a wealth of data, perhaps more data than you know what to do with. They're fashion wearables. They can look quite trendy sometimes, but they don't always offer the same thing that a professional device requires. So a professional device needs to be simple to use, have a long battery life, preferably with no charging required. Needs to be waterproof so that you have high compliance and be able to be used by multiple participants to get the best bang for your buck with the use of the device. So easy to clean, made from medical grade components, and together with having validated algorithms. Excuse me. There needs to be a health understanding that sits behind the device. And often feedback needs to be separate from the data collection. Otherwise, you're going to perhaps confound the data. You're not going to have a true picture of what the patient's behaviour truly is, because people are very willing to please and can skew their behaviour accordingly. Provide good customer service and provide a complete service solution so that all the data analytics are in one place. Data protection and data security are incredibly important. And our devices are made to medical standards in ISO facilities. Privacy by design is becoming much more important now with GDPR, and we've taken this into account right from the conception of the product through to full development. And devices need to have interoperability so that they can be used with other software or different development applications. So just very briefly, I'm sure most people here have heard about the GDPR, the new General Data Protection Regulation that's coming in at the end of this month. It's because more and more people are putting more data onto the internet. You know, we're all happy to put our height, weight, personal data into systems. And the current legislation was enacted before any of this, before the internet and before cloud technology existed. And had created new ways of exploiting data. So it's trying to control how personal data is used and to improve trust in the digital economy. So about our products, we have two different types of devices. Our first device, which is shown here, the Genie Active device, it's a wrist-worn accelerometer. It's been on the market since 2008, and it was the first wrist-worn waterproof accelerometer, and it's been used worldwide. Key feature of this is that it's raw data, so we don't filter the data in any way, and can collect data on the standard device at 100 Hertz. So that means you're collecting data at 100 times a second on 3 different axes. So it can give you a very informative picture of human movement. It's waterproof and robust. It's been tested it's been used in an epidemiological study in street kids in Brazil. You know, they come back fairly battered, but they survive to tell the tale. There's the ability to record data for up to a month. Ergonomic design, so designed for free living research, you know, they don't need to be taken off. And so we've got different variations that can collect data at much higher frequencies or that have direct skin temperature sensors. From all our learnings from our Genie Active device, we've created the ActivInsights Band, which is a new product which is new to market this year. And that's designed to intelligently measure and record activity. And it then analyses the data for the individual and provides visualisation of objective lifestyle patterns. So there is no requirement for the user to do any form of data analysis, which makes it perfect in a professional setting. Again, it's fully waterproof, but this device doesn't require charging as it has battery life of 12 months. So I'm going to talk a little bit about raw data and what some of the benefits are. So with raw data, you can choose a variable sample rate and data frequency over a wide dynamic range. So we provide from 10,000 down to about 5 hertz. So that's a huge range of human movement. And the data's unfiltered in standard units with reliable timestamps. And what that means is it provides you with the option of data that's back and forward compatible for future studies. Because there is no processing, no filtering of the data, you can go back, or forward, however you do with your different studies, and it's very easy to back compare. Whereas traditionally with other accelerometry data, you haven't been able to compare as there's been new iterations in software. Although you have got the option as well to be able to condense the data depending on what you want to look at. So raw data removes the limitations of the traditional count-based data and allows us to look at environment, motion and posture. So an example of raw data is in sleep. And this graph here shows how an accelerometer, when it's at rest, can be used as a positional sensor. So you haven't got an acceleration going through the device at the time. This graph is purely on position of the wrist and wrist rotation. And it's showing period of night sleep from about 8 o'clock to, I can't see on the scale, but until the next morning. And you can see periods of uninterrupted sleep here. You can see here there's a period of more interrupted sleep. Looks like the individuals got up through to the point where they're fully up and awake and up on their day. Traditionally, in sleep actigraphy, professionals use a double plot for sleep. So that's where you're plotting 2 days of activity on the same chart so that you can clearly see the night's activity. This is particularly useful if you're looking at shift workers or people with atypical sleep patterns. In actigraphy labs, what they actually have to do is manually go through and score each one of these, which obviously requires a dedicated professional and is extremely time consuming. But by using our algorithms and frequency plots, then we can produce a hypnogram, which is the same output as the sleep professionals produce, and it's making life much easier for them. Performance. In terms of sport, millisecond performances can win or lose a race. They can be the difference between whether you bring home that medal or not. We've looked at throwing sports, so we've worked with the England cricket team. Now you can sort of decide for yourself whether that's been a benefit or not. However, in terms of throwing sports, often injury comes from incorrect throwing, overuse, overtraining, and being able to correctly map at high intensity the reconstruction of the throw helps the coaches to be able to correctly position the arm and fully optimize the throw. In terms of swimming, very fine tuning to training regimes can make a huge difference. And in swimming, it's important to be as streamlined as possible in the water until the moment you actually take the stroke. And when the stroke's taken, at that point, you want to generate as much acceleration through the water as possible and then become streamlined again. It's been used by teams in Canada looking at position of swimming in the water together with high resolution video technology. And this graph here shows a preferred body motion through the water. And this you can see is slightly different. This is less optimal. And it's allowing the coaches to work together to help improve some of those techniques which traditionally have been quite difficult to do. In footballers, we've been working with Premiership football team looking at general lifestyle. So people can be put into two groups of chronotype, so how they sleep, whether they're larks or owls. Now, those people with teenagers will know that, you know, you can't get them out of bed in the morning for love nor money, but they're happy to stay up all night. Whereas when we get older, we're perhaps happier to go to bed earlier and get up earlier. And what the football team have been trying to do is optimise football training to the chronotype of their individuals, because, you know, they've got people from late teens through to 30s in the team, so very different range of chronotypes. But if you're forcing those younger kids to get up, do their training at a time when actually their body's saying, I really want to be asleep, are you actually getting the best out of them? So it's all about tailoring performance. So there's lots of different ways to use these devices. When an accelerometer's at rest, it can be used to measure sedentary behaviour, and we know that the population's becoming more sedentary. And it's important not just to know that they're sedentary, but to understand what those behaviours are. So if an accelerometer is totally stationary, the only force it's got acting upon it is gravity. And we can use that because if you imagine my arm is the centre of a sphere, which I haven't got the range of movement to be able to do that, but even if I was stationary, I've got the ability to position my arm at any point on that sphere. So this is a representation of office work. So we know that these people are being sedentary. It gives a characteristic cluster because when you think about it, if you're sat at a desk, your arm's generally not down by your side. You're sitting at a desk typing, or maybe you're doing some phone on the telephone when your wrist is elevated. Watching TV gives a different position again. And when you sleep, you notice very few positional changes. So using different analysis techniques, it's allowing us to better understand sedentary behaviours. And if you put this all together as a composite picture, you've got your office work, your TV work, you've got sleep somewhere. This is walking. So as soon as you start to move, as soon as you exert an acceleration on the accelerometer, then you move away from the surface of the sphere. So as I said, we've put all our learnings into developing the ActivInsights band, which is simple to use, and for a significant chunk of the target demographic, the device must be very easy to use with low or no user burden. So what does the customer or patient journey look like if you're going to use one of these devices? Well, you'd visit your clinician, and maybe you want to improve your cardiac output or outcomes, or diabetes, or lose weight, whatever. You come and see a health professional, they issue you with a device, you go away and wear it for a week or so, and when you return, you upload your data. No personal identifying information leaves the health professional's computer, but your behaviour data goes to a server where it's instantly analysed and a report on your lifestyle can be downloaded so that it's instantly available to facilitate an interactive discussion, to be able to set lifestyle targets and behaviour plans. And then you can reissue the device, or you can say, come back to me in a few months and we'll have a look at your activity, and you can reissue the band to somebody else. So it's got very high turnover, so you're getting better return on investment for use of the device. 1 week of wear provides enough data to be able to provide a differential diagnosis, pretty much. Understanding context, it has to be personal. It has to relate to the person. There isn't any margin for error. As soon as you see some data on there that's not reflective of your life, the professional's going to lose faith in the product, and the patient or the customer isn't going to use it anymore because there's no point, because it doesn't represent their data. So it's really important to get this right. A typical output from the band is like this. So it's showing daily activity of periods of when they're asleep to when they're doing different types of activity. There's an event button marker, which is here, which can be user-defined. It's easy to press intentionally, but difficult to press by accident. And the user sets the definition, so smoking cessation or medication taking or falls, whatever, you can press the button. Within the event-based coding that we do for this type of device, we've got the power to be able to recognise when people are on transport. So a lot of devices that you have, you'll note that if you're in the car, you'll see that it's measured X number of steps or whatever. But we can filter that out because we can recognise from frequency analytics that the person is on transport. A simpler way of looking at sleep, if you remember I showed you the raw data sleep, another way of looking at sleep can just give you very basic information on circadian cycles of sleep time, sleep duration and sleep quality. So you can make this as simple or as complicated as you like. We developed all our data architecture using open standards from Coalition, which is an independent not-for-profit organisation that promotes responsible use of personal data. Within healthcare, there's so many uses for these things, from cardiac rehab through to cancer, sedentary behaviour, bariatric surgery, huge lifestyle epidemiological studies. The ActivInsights band's only been available on the market this year, but it's currently deployed within the UK, Canada and Australia, giving an accurate picture of overall activity. An example of a case study in the UK is within NHS healthcare rehabilitation. An 8-week rehabilitation of balance and safety intervention in falls patients. So people that have had falls come into the clinic and they're put on a programme for 8 weeks and they're given 1.5 hours of exercise training a week for those 8 weeks to help improve their outcomes. Now, NICE recommends 50 hours of balance and strength training exercise a month to be able to build bone and muscle. So obviously they've got to do some activity within their own time. And they compared the ActivInsights band with the subjective paper diaries that they traditionally used. And they saw increased Tonetti score, which is a measure of gait and balance, reduced incidence of falls, increased physical activity, and decreased decline in activity due to poor health. The diaries were less accurate, and the patients certainly weren't very keen on completing them if they were given the option of wearing a device. And then they enthusiastically wanted to wear the devices. And so it's been incredibly successful, and the device is being cascaded to lots of different centres within various CCGs. And other applications, as I've already said, diabetes, cardiac rehab, weight management. So what about beyond primary healthcare? Well, lifestyle is a dominant factor in performance both at work and in sport, and hugely influences our physical well-being, and as well as helping us sustain quality of life as we age. Using the same core infrastructure and products, there's a list of areas here where it's all extremely valuable. Occupational health. The use of wearables in occupational health setting is certainly capturing the imagination of some businesses as soon as they realise that there's perhaps a potential for them to be able to make some savings through increased productivity, improved job satisfaction, increased employee well-being, and reduced work-related injuries. Goldsmiths University in London carried out a study with 120 participants with the Genie Active and reported an increased performance at work in those that were given feedback from their device rather than controls. And in workplace health promotion, again, they've shown decrease in occupational sitting and increase in physical activity in office workers through use of wearables. There's lots of different ways of targeting improved physical activity. Community-driven interventions. We've been working closely with the Community Sports Trust, and their ethos is about developing sport and physical activity opportunities for people where they live and work. Being active should be fun, and it needs to be local, and it needs to be affordable and be able to everybody to integrate it into their everyday lives. it's not just about the worried well and improving those people that have they have their Fitbit or whatever and they're already interested in their device. That's almost a small segment of the issue. It's about engaging a wider community, and it's often resident-led. And rather than delivering programs directly targeted to get people active, this approach works by building relationships between different social groups and connecting people together to help them take responsibility for their own data and help them to be more active. So as ActivInsights, we work with lots of different organisations, and you might have seen our products pop up. They're used quite regularly in health documentaries and popular science shows when they're measuring sleep and other aspects of lifestyle. So to summarise the two devices, and I should have said as well, made in Britain, they're all completely made in Britain. We pride ourselves on that we don't outsource it to China, which a lot of places do. So the Genie Active, raw data collection, high data resolution, open analytics, waterproof and robust, and can record data continuously for up to a month. The ActivInsights band provides a complete data solution with a bespoke data analysis services, so removes all the burden of analysis. It's wireless, it's waterproof and robust, and has a battery life of 1 year. So we've got a wealth of experience in unfiltered movement data, from single device proof of concept studies through to cohort studies of 10,000 plus. We've got over 300 publications now, and we've got customers in over 40 companies. And we're continually developing through internal and external development programs. So when we're talking about embracing preventative healthcare, it's very difficult, it's not easy, and to help tackle global health challenges, professional wearable technology has to be accurate, has to be reliable, easy to deploy, adhere to global data standards, be acceptable to clients, emphasise the benefits of self-care and preventative healthcare, and have excellent wear compliance. So the fundamentals of health behaviours aren't rocket science, and they've been known for millennia. Plato here says lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. But the data understanding and analysis and capability to facilitate global behaviour change is a much more significant challenge. Thank you. I'll take any questions.
Thanks for that. You said this device could be useful in fall prevention. Can it be useful in detecting when a fall's happened?
No, not at the moment. That is something that we're working on. It's very difficult. Unless you were going to use the event button marker, you wouldn't necessarily know if somebody had just bent. It's a very specific set of movement characteristics, but that is certainly something that we're working on in terms of detection within the home, and then sending signals to the GP or whatever, or the carer that somebody has had a fall. It's certainly something that would be incredibly useful to have, and it's in progress, but it's not there yet.
Thank you very much for your presentation. If we talk about use by ordinary people without any medical research degree as such, what type of feedback can I get from the active band? Will it be how well I sleep and how many steps I made?
So they're not available to consumers. So they're only available to researchers or through professional setting.
Actually, why wouldn't you allow this band also to normal users? Because if you do want to increase prevention, I think having some sort of pleasing bias may actually be a good thing, wouldn't it?
Yes, I see where you're coming from, but at the moment, generally the device doesn't provide direct feedback, and the discussions that we've had with various health professionals is that they prefer it not to have direct feedback. And if you as a consumer had your own device, you need to have some feedback from that and some action. It's no good just having the data. You've got to know what to do with the data and how it can impact your life. And there are so many devices within the consumer market. I mean, I think there's about 300 devices at the moment that, you know, that there's various models and makes and models that we can all name that sort of monopolise that area, that segment of the market. And within consumer wearables, you can question how accurate the devices need to be if it's going to make you more active. There's an argument there for that.
Is it a medical device? Has it been CE marked? Has it, you know, you were talking about your validation of
Yeah,
algorithms.
it's CE marked, yes. CE marked and produced to ISO, whatever state. It's produced in an ISO facility.
Thanks for your presentation. Just a couple of questions. So if we were thinking about research with children, do you have smaller versions or smaller bands that they fit onto?
What, for the band or the Genie Active?
So either of the...
So the Genie Active's been used in lots of children's studies. It's the preferred band in research for children. We've got special straps. We can use the Tyvek straps, you know, the fairground wrist straps, which are very difficult for them to take off. Or we have got smaller straps as well. At the moment, the ActivInsights band is a 1 or 2 size strap. There aren't any particularly small ones for children at the moment, but that will come in the future. It's because the strap is moulded to the device in a different way to the Genie Active.
Okay, and the second question, are you able to customise reports?
Yes, definitely. Yeah, so the examples I showed you are just examples, and we could customise it, the output, to whatever people are particularly looking for.
I might have missed this. I came in slightly late. And I'm not sure how far ahead and what you've done with it, but is there anything to... Because obviously you can see that there could be some potential health benefits and understand how that would impact. But is there anything to suggest what the cost effectiveness and any sort of cost benefit analysis? Because I know, certainly having worked with GPs, for example, that is one of the big things that they always ask, you know, who's it going to benefit and how much does it cost?
Yeah, I touched on that earlier. So within preventative healthcare, it is quite challenging. So the end users, the GPs and the other health professionals definitely see the benefits of preventative healthcare, but the accountants want to see a faster return on investment, and it's very difficult to show a quick return on investment for something like preventative healthcare. So it is sort of chipping away, because the budget of the NHS isn't infinite. We all know the issues. I'm just using the NHS as an example. You know, the sort of lifestyle factors take up a huge chunk of the NHS budget, and we really do need better preventative healthcare strategies. But it's chipping away at a very constrained system.
Well, I'd like to thank Tina for giving this symposium today and for exhibiting on behalf of ActivInsights. As I said earlier, Tina will be here for another hour.
Yeah, just to the end of the coffee break.
Yeah, and then her colleague will be here tomorrow, Stephanie. So thank you very much, Tina.
Thanks, Anna. Thank you.
We're now into the next session. In the Beryl, we're going to have telehealth, and over in the library, we've got environment number 2 session. So please make your way to the respective venue.